The current COVID-19 pandemic has compelled research teams to move their studies to remote methods in order to respect safety guidelines. However, with cognitive screening tools such as the Montreal Cognitive Assessment, it is crucial to ensure the measure of cognitive functions as unaffected by the sensory abilities of patients or other factors when administered in remote conditions. The valid and reliable telephone administration of the MoCA has not been reported in visually impaired individuals. Alteration to standardized tools may not be adapted for all clinical groups, may jeopardize the integrity of the test, or might lead to a misinterpretation of results. Taking into account all of the information mentioned here, our first objective is to determine the test-retest reliability of the MoCA-Blind, where the visual items are removed, when administered over the phone compared to in person. The second objective is to identify the facilitators and barriers of conducting research over the phone from the perspectives of both the participants and the test administrators.
This project will use a test-retest methodology. Half of the participants will be tested in person first and then over the phone 4 weeks later, and vice versa for the other half of the sample. For time 1, all the measures you see on the screen were part of a much bigger research study that is currently ongoing in our research lab. The measures in bold are the ones we will be using in our current remote protocol. At time 2, participants will also complete a COVID-19 questionnaire to explore the effect of the pandemic on their mental health, a telephone use questionnaire to establish their familiarity with the phone modality, the MoCA-Blind, and they will also take part in a semi-structured interview to discuss their experience of participating in a research project over the phone. Our participants are older adults with low vision, as well as normally sighted older adults. An additional aspect of our study will examine the experience of the research assistants who will conduct the testing session. They will complete a report after each testing session to report on the barriers and the facilitators of the phone modality, as well as a global questionnaire at the end of the project to reflect back on their experience of testing over the phone. As of now, our in-person testing sample has a mean age of 82.3 years, with a standard deviation of 8.5 in a range of 65 years old to 97. The MoCA-Blind scored at a mean of 15.8 with a standard deviation of 3.1. 13 experimental participants out of 38 passed the MoCA-Blind at time 1. In-person and telephone MoCA-B scores will be compared using Bland-Altman plots.
We anticipate that the results of the proposed research study will significantly contribute to the field of telehealth, as the need for accessible online cognitive screening tools has reached an unprecedented need due to COVID-19 safety guidelines. Also, very few studies actually validate the different tests by comparing the results of face-to-face and remote administration by reporting reliability data resulting from a rigorous protocol and exploring the discrepancy in scoring that may be influenced by a change of test setting. Our participants represent an extreme type of clinical sample in which cognitive screening, even when administered face-to-face, is already difficult. If telephone administration demonstrates reliability, it could also be administered in a normal aging population. This study also has clinical implications as it will increase access to health services for people with physical, sensory, and/or cognitive limitations which cannot necessarily travel independently.